Hello friends, welcome back to my YouTube channel. I am Dr. Vijayan Govinda Gupta, an andrologist and a ZSR Circumcision specialist present in New Delhi, India. Today we are going to discuss what is ZSR Circumcision, why this circumcision is as of now the best circumcision method available anywhere on the planet, why ZSR Circumcision holds so many benefits, what are the real long-term benefits that you can get if you opt to go from this circumcision method, how to avail of this facility if you are living in India or if you are living abroad, and what are the disadvantages of using this technique. Let me start with the beginning that I do more than 5,000 circumcisions in a year. We normally do around 500 to 550 cases in a month, and I am by far the largest ZSR circumcision surgeon in India or in the world for that matter. 99% of my practice is on adults. We usually treat less number of children because we usually get less number of ritual circumcisions, and most of the circumcision done at my clinic are in adults who are either suffering from the various kinds of phimosis and balanitis problems or are going for a cosmetic circumcision because of their requirement. Why a circumcision is required, the advantages of circumcision, what is phimosis, what is balanitis, what is a tight frenulum, what is paraphimosis, and there are hundreds of other videos on the topic of the foreskin and the glans complex. And if you go into the playlist of my channel or my Hindi channel, you will get enough amount of information on these topics. Today's topic is specifically to understand that what is ZSR circumcision and what are its benefits. So ZSR circumcision is basically a circumcision stapler. This stapler was developed by a company in China called as ZSR Biomedical Corporation. This stapler was then gone through trials in Britain, got the European certification, and after that was introduced in many parts of the world. This circumcision stapler was introduced in India and especially in North India by me for performing circumcisions in adults. This circumcision stapler was originally designed to perform circumcisions in children, but the adult sizes were developed under my leadership, after which these circumcisions were started. This stapler was basically started to be used in adults for problems like phimosis. This circumcision stapler has tremendous advantages. The main 5 advantages of this circumcision is that 1, it is a stitchless technique. Normally in traditional circumcision, regular circumcisions, what is done is that the foreskin that needs to be removed is first marked and then it is cut. After cutting, the various edges of the mucosal as well as the skin edges are cleaned and the bleeding is stopped. After the bleeding is stopped, these edges are then stitched together with a suture. The suture may be absorbable or non-absorbable suture depending upon the surgeon's choice. What happens due to this is that the traditional circumcision takes time because you have to cut the tissue. Second, it takes a lot of effort because the bleeding has to be stopped. Because of that, a lot of edema kind of develops in the post-operative period because it takes around 35 to 45 minutes to finish a traditional stitch job. And how much ever well you may do it, when you stitch the skin edges together, you will always get ragged margins. You will not be able to correctly oppose all the edges at the same time. You may not get a perfect circular cut, and sometimes the stitches don't heal well and there are risks of getting infections or risks of getting a very dirty, ugly scar in the post-operative period. ZSR circumcision eliminates all of that. Because it is a mechanized stapler, it cuts, seals the skin edges at the same time. Because of this, what you get is a completely circular cut. You don't get any ragged margins. The skin edges are not crushed together and the skin edges are always sealed together in a perfectly round shape. Because no stitches are used, it uses a patented technology which uses a silicone ring which basically gets attached to the edges, and on the silicone rings the titanium staples form to hold the skin edges together. Since there are no puncture marks, because of that no scarring, keloid or any dirty scars develop. Because it's a quick process, it just takes less than a minute to do, the patient does not feel any pain and there is no loss of blood. So if you look at it in a totality, it is a stitchless circumcision. There is no stitches that are applied. It is a bloodless circumcision. There is no blood that is lost. It is a scarless circumcision. There is no dirty or ugly scars from the suture line or from ragged margins. It is a quick surgery. It takes less than a minute to do. Post surgery, it is completely painless. Now, why doesn't pain happen in ZSR? Pain doesn't happen in ZSR circumcision because of three main reasons. One, because it is so quick that a tissue trauma, the tissue handling is minimum, because of which post-operatively patients don't develop edema, don't develop painful problems. Second, there is no blood loss, because of which there is no dead tissue or necrotic tissue which leads to pain. So that is one more reason why there is no pain that happens. And third is the triple anesthesia technique, the patented trademark triple anesthesia technique that is used in my clinic, in which we use a combination of local anesthetics, sprays and injectables to give the patient a completely pain-free experience. So because of these massive advantages, ZSR circumcision has now become the go-to method to perform circumcision anywhere in the world. Now, apart from ZSR, there are other methods of circumcision like Alice clamp circumcision, there is the Shang ring, then there are the traditional sleeve resection method of WHO. So we will discuss these different circumcisions in a comparison to ZSR in a different video. Now, are there any disadvantages of the ZSR? There are some disadvantages of this technique. The first disadvantage of this technique is that in very severe phimosis, in those patients in whom BXO has developed, the phimosis has become very bad, the skin has completely stuck together, there is no glans left. In those very severe cases, ZSR cannot be utilized. But even in those cases, because of my experience, nowadays we are doing even the toughest phimotic cases that nobody else is able to manage. We are able to do them with ZSR and give the patients an extremely pleasing result. But usually we have to use a hybrid technique in which we use a ZSR along with a few stitches, but this is reserved for a very select few patients who come in very late, or who have severe amount of diabetes and who have a severe amount of infection, who need to be managed in a very different way. This is one more reason why you should always get your circumcision done from an expert who is doing a lot of cases, because sometimes it is the expertise of managing different kind of phimosis that is able to give you a good cosmetic result. Sometimes a surgeon may just start doing ZSR in the first 10 to 12 cases and he is not able to manage complications and ends up giving a terrible result where he could have given a fantastic result. The second disadvantage of this surgery is the cost. The ZSR circumcision stapler is a completely disposable device which needs to be thrown after every surgery. We cannot reuse the device, and this has a lot of safety attached to it, but at the same time, because of its disposable nature, the circumcision tends to be a little more expensive than regular circumcision. But still, at my clinic, because of the volume that we do right now, we are offering ZSR circumcision maybe at a rate that is even cheaper than getting a regular cut and stitch circumcision anywhere in India. So if you're looking for a good quality circumcision for your phimosis and you're looking for expertise that you can bank upon to get a very good result even in the most difficult cases, then you need to contact my clinic and date your circumcision surgery in New Delhi with us. Our clinic is easily available on Google Maps, is available on WhatsApp, is available on Facebook, it's available on email, and on the given phone numbers. You can always connect with us and solve your doubts, solve your queries before coming in, and then schedule an appointment and get your surgery done with us. Thank you for listening in. Stay tuned. Take care. Please subscribe to the channel to get constant updates regarding the topic of phimosis and circumcision. Thank you.